Welcome to the North Country Health Consortium's webinar, The Role of Community Health Workers, a resource for your practice and community. For continuing education purposes, this slide is for learners to be aware that the planning committee and presenters do not have any active conflicts to disclose. This webinar will be presented to you by myself, Amber Culver, the consortium's Ways2Wellness CONNECT Community Health Worker, Annette Carbonneau, Program Manager, and Allison Bro, Weeks Medical Center, the Chronic Care Management RN. The objectives of today's webinar is to understand the value of the Community Health Worker, or CHW, model as a strategy for improving access and coordination of services, to explain how the CHW model can be used to improve the quality and safety of healthcare by improving care transitions from hospitals to other settings, to describe the effectiveness and return on investment of CHW integration into care teams to reduce hospital readmissions, address high rates of hospitalizations among the population, and inappropriate emergency department visits. To recall 3 mechanisms for referring patients to the Ways2Wellness CONNECT CHW program, and to recall the Ways2Wellness CONNECT program patient eligibility guidelines for the CHW services. For those who are unfamiliar with the North Country Health Consortium, we're located in Littleton, New Hampshire, and we serve Upper Grafton and all of Coos County. The North Country Health Consortium seeks to meet the unmet health needs of our region. So this includes healthcare workforce shortages, gaps in the continuum of care for those that are unable to navigate the complex healthcare system, high emergency department utilization, social determinants of health, and rural health disparities, such as our geographic isolation, an older population, and high rates of behaviors that contribute to chronic disease. Looking at the map, our service area is the dark green North Country section. So what is a community health worker? A community health worker, as defined by the American Public Health Association, is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. So community health workers play that connection between clients, the medical home, and those community resources. So are you a community health worker, or do you have community health workers who work for you? Some of common names: care managers, a lay health educator, case managers, social workers, patient navigators. There's many, many names for community health workers. The community health worker is a member of the healthcare team that can address the whole person outside of the provider's office. That may be in their home, at a community meeting space such as a library, a restaurant, a park or coffee shop, or just any other setting that seems to make sense for the client. It may be in the provider's office, it may be at the grocery store. There are certain qualities that a community health worker really should possess. And some of these are membership in or shared experience with the community in which they work. So to be the most connected to the community that we're serving, we really should be from that community or just have a really strong understanding of it. I could not be an effective community health worker living in Boston, Massachusetts, because I don't understand the area and the culture. I don't know the people. So just like a community health worker from Boston couldn't really be that effective in our small rural towns here in northern New Hampshire. They should be friendly and outgoing, open-minded and non-judgmental, motivated and capable of self-directed work. Often we're out on the roads working miles away from the office. We could be typing our notes at the local library, reviewing our next appointment in a Dunkin' Donuts parking lot. We really must be able to complete our work and figure out our next steps without that constant supervision. We need to be caring and compassionate, respectful, flexible, and adaptable. The human element is not always stable. We cannot always count on our day going how we planned it to go. So we need to be able to adapt to that, take things as they go. We need to have a desire to help our community. We need to be resourceful, and we really should be a model for trying to live a healthy lifestyle. For education and training of community health workers, the North Country Health Consortium offers their own community health worker training. There are other courses available for community health workers in different areas of the state. So the consortium's training it's a 12-week hybrid course. So there's 6 in-person sessions and then 5 online units. There's usually about 2 weeks in between each in-person session. And during those 2 weeks, that's when the students will work on and complete those online modules. There's also a 2-day in-person motivational interviewing course kind of in there. And that is a great resource for community health workers and other health professionals as well. At all of the in-person sessions, there's a guest speaker who will talk to the students about different topics. They all have their own specialty. And some of those topics are diabetes, self-care and caregiver care. There's chronic disease management, health and wellness, and also oral health. We also provide opportunities for community health workers to receive further training with topic-specific online modules. We've created online modules that students may complete after the regular CHW training course. And these are focused on different topics such as behavioral health, medication adherence, women's health, specifically breast and cervical cancer, and also diabetes. These courses are available through Moodle, which is an online learning platform, and it's available to all the community health workers who go through our training. Our course is based on national core competencies for community health workers, and you'll learn more about those on the next slide. This program was originally created in the San Francisco area, and so we took that course and adapted it to focus more on the North Country culture. The textbook that we use is called Foundations for Community Health Workers, and currently in the state of New Hampshire, as of 2018, there's no official CHW certification, although that's something that CHWs in the state of New Hampshire are certainly looking towards. Here you can see a handful of the national standard community health worker competencies and complementing roles. So you can see it's divided into those core roles and then those core competencies. Some of those roles include health education, advocating for both individuals and communities, navigation and access of the healthcare systems, providing referrals, or direct services, depending on the program. And then some of the core competencies that we need to have are communication skills, those organizational skills, a knowledge base of our area and the resources that we're trying to connect patients with, teaching skills, and then just some service coordination skills. There's a much more extensive list available if you go to the link at the bottom of the screen. So for more information on those, you can go there.
Supervision. Community health workers generally don't work in an office setting. They are out at clients' homes, they're meeting with providers, and in communities, seeking solutions for clients and establishing relationships with social service providers. This does not make for a predictable 9-to-5 day. Community health worker supervision at the North Country Health Consortium is done both one-on-one and in a team meeting setting. Supervision includes a review of client cases, brainstorming on reduction of barriers, addressing professional development, review of completed notes, documentation, and an overview of data entry, and any review or updates around policies and procedures. Working with clients in their home can present unique challenges. Community health workers are driven to problem solve and think outside of the box when they're working to find resources for clients. Having a clear set of boundaries to guide them is very important. It helps them in their independent decision making. It also helps their clients to not create unrealistic expectations, and it helps for providers to feel confident in the role that CHWs play in their patients' lives and for the organization they're employed by. Boundaries. The North Country Health Consortium community health workers are provided training and tools in decision making. Basic boundaries are defined, and community health workers are provided with documents that will guide them. For example, if a client has concerns about their medication, community health workers are not to make any specific recommendations, but instead help the client find their voice and an opportunity to share those concerns with their medical provider. Another example is diagnosis. Community health workers are not there to provide either patients, family members, or the providers with their opinions related to diagnosis. Instead, they must share the health challenges they see with both the provider, the family, and often the client. Family matters can be very difficult. Community health workers have an alliance to their client, but in family discussion about family, everybody's opinions matter. The community health worker can assist the client to better articulate their needs, their desires, and communicate that with their family. The value of community health workers. There are 3 common attributes of effective community health workers, and this is referenced from Advancing the Professional Sustainability of Community Health Workers from the Center for Healthcare Research and Transformation. And I think it's worth adding to this webinar. The first one is the capacity to harness shared experiences to build trust with patients, to improve healthcare and human service systems navigation, and to anticipate potential barriers to addressing health and social needs. The second one is the capacity to serve as a cultural bridge between patients and providers so that providers are better able to understand patients' health problems and adapt their services to better serve their patients. And the third, the ability to advocate on behalf of patients, helping to change the systemic policies and practices that get in the way of improved health and access to care. So what are the advantages for healthcare organizations to include community health workers as part of their care team? The first advantage, increased organizational capacity to achieve triple aim, which is improved population health, enhanced patient experience, and reduced healthcare costs. Then the enhancing the provider's understanding of the patient's environment outside of the care setting. So community health workers are the eyes and ears for the provider, and that insight can really guide health-related decisions. And thirdly, community health workers follow up with patients in their homes and communities to help mitigate factors that increase the utilization of healthcare or ED services, therefore resulting in cost savings for all the health systems.
Social determinants of health. This is a term that everybody seems to be talking about, and this is really where community health workers are invaluable. So the social determinants of health are the economic and social conditions and their distribution among the population that influence individual and group differences in health status. So this could include your access to health care. Are you insured? Do you have transportation to get to your medical appointments? What's your home life like? Do you have enough money to heat your home? Are you worried about that? Are you worried about having enough food? Is your housing condition safe? Do you have any social supports, or are you doing all of this on your own? Do you wonder where your next paycheck is going to come from? And when you do get to the doctor's office and then they talk to you about what's going on, Do you understand what they're telling you? Can you read the information that they're giving you? CHWs can help patients overcome barriers regarding these social determinants and make significant impacts in the patient's life. These are all things that a provider may not have time to address in the appointment, but somebody needs to. This is a graphic that just kind of illustrates the idea that a healthy life truly does begin at home. So whether it's difficulty buying healthy food, struggling to afford proper heating for your home, being overwhelmed with stress, being isolated from friends and family, all of these things can contribute to poor health.
Effectiveness and return on investment. We know that socioeconomic and behavioral factors can negatively influence post-hospital outcomes, especially among patients of low socioeconomic status. And we also know that traditional hospital personnel often lack the time, the skills, and the community linkages required to address these factors. In Philadelphia, they conducted a patient-centered community health worker intervention to improve post-hospital outcomes. During a hospital admission, community health workers worked with patients to create individualized action plans for achieving patients' goals for recovery. And then the community health workers provided support tailored to the patient goals for a minimum of 2 weeks. The conclusion was that patient-centered community health worker intervention improves both the access to primary care and the quality of discharge, while still controlling recurrent readmissions in a high-risk population. You can see on the slide that the return on investment was $1.80 to $1, which means for every dollar spent, it was an $1.80 savings. In New Mexico, Molina Healthcare's Community Connector Program assigned community health workers to reach members with complex health issues or those who were heavy utilizers of services. They screened all patients that were seeking care at participating clinics for social determinants of health. If the patient needed and wanted help to deal with social determinants, they would be referred to a community health worker, who would in turn work with that patient to connect them to community resources to address those identified needs. And in Texas, the Christus Health System and Memorial Hermann Hospital employed community health workers to work with emergency department patients, resulting in a return on investment of 3 to 1 up to 15 to 1. For years, the American Hospital Association has urged hospitals to evolve into health systems partnering with community organizations, and to consider that acute illness is a signal that triggers patient-centered care extending beyond hospitalization. Community health workers are part of this evolution. In most states, including in New Hampshire, community health worker services are not reimbursable. The value of community health worker programs has certainly pushed health and social service organizations to seek out those sustainable funding opportunities. As I shared in the previous slide, certainly proving return on investment and cost-benefit analysis is a great way to fund the programs. But in addition, there are several other options. Medicaid reimbursement is something that many states are looking at and several states have implemented. The barrier to this is the time frame that it will take to create and implement a certification process in the state. This would require buy-in on both state and local levels, and some legislation would be involved in that process too. State funding through public health departments, this is a route that Massachusetts has gone with. From day one, their programs have been funded through their public health departments. Again, because the state understands that the value of the work that the community health workers do actually saves the state a tremendous amount of money. So it's well worth going that route. Then there are alternative payment models, and there are several different options under that. Certainly a value-based payment option where the goal is to shift from pure volume-based payment to payments that are more closely related to outcomes. And looking at the ACO model, which creates an incentive for providers to be more efficient and effectively manage the health of their patients, regardless of where they're seen for services. And the outcome of that is when the ACO succeeds at both delivering high quality care and spending money more wisely, then the ACO shares in the savings that it achieves. And again, this could be a good option to be financing and sustaining community health worker programs in the future.
Those of you who work and live in the North Country already know that this area certainly presents some different challenges. This rural challenge, the North Country spirit. The population up here is just so fiercely independent, very private and guarded, quite prideful. And a lot of the times they're unwilling to ask for help. That pride tends to get in the way. And when it comes to access, there's such long distances between some locations, whether it be from your home to a doctor's office, the doctor's office to a pharmacy. It's just, there can be a lot of travel involved. And there's very limited public transportation, especially the further north that you go. There's very few health centers. There are some, but there's few and far between with affordable or free care for those that are uninsured. We do have the federally qualified health centers, one in Littleton and one in Colebrook, but still that's quite the distance for some people. In 2017, the North Country Health Consortium did a survey of many local health and social service organizations on what they already knew about community health workers and whether or not they felt that community health workers could benefit the people in our area. We wanted to know if these people understood the role of community health workers and if they currently had positions in their organization that already fulfilled this role or were of similar nature. We wanted to know what kind of training and assistance would they need to integrate CHWs into their current workflows. And then we wanted to be able to identify any opportunities to incorporate community health workers into the prevention and management of chronic disease. So here are some of the questions that we asked in the survey. So when we asked them, what would you see as a community health worker's primary focus? Over 70% of the respondents felt that direct client or community education should be our primary focus. Some other answers were decreasing patient readmissions and providing resources and general outreach. When asked what kind of technical assistance would your organization need to incorporate community health workers, over 80% of them said that the technical assistance required would be to find those funding sources to support community health workers. Some other answers were creating policies and procedures, and then the behind-the-scenes administrative type work. Barriers to incorporating community health workers into their organization. The biggest barrier that about half of them said would be there's just a general lack of structure currently in place at their organization that would support a community health worker. And some other answers included people didn't quite understand the role of community health workers. They needed more definition on that. Funding, which is always a barrier. And they didn't quite understand the advantages or benefits of community health workers. They needed more explanation on that. And how do you fund the current community health worker type positions that already exist in their organization? And we learned that most of them are either grant funded. There was a couple that had the CHW built into their budget. And a couple of quotes that we got from people while we were interviewing them. One person said that community health workers are essential if we're trying to support elders in their homes. And another person said that community health workers can be helpful in providing more case management and more investigation than we are able to do with our current high caseloads. So to address some of those challenges, we have the Ways to Wellness Connect program. So this program is taking the community health workers and linking them to those patients that are struggling with those unmanaged chronic diseases and experiencing those barriers to achieving just that overall health and wellness and enhancing their quality of life. The Ways to Wellness program is more than just the Connect the CHWs. So you can go to that ways2wellness.org website, and you can see more on how the Ways to Wellness program can benefit both community members and providers. The Ways to Wellness Connect CHW program is funded through state and federal funds to allow the North Country Health Consortium to develop the CHW program specifically for our North Country region. The Ways to Wellness Connect program has been in operation for about a year and a half, and we have so far provided services to just over 80 patients. We partner with hospitals, health centers, and human service organizations. And these partnerships with those local healthcare organizations is critical to the quality improvement of our program and collecting that data that will help support the growth and the future sustainability of this program. Currently, there is no cost to either the patient or the provider for our program. So the Ways to Wellness Connect CHW program serves patients ages 65 and older. And we help participate in discharge planning to provide ongoing support after hospitalization. So those patients that have been admitted to the hospital, we help them transition back home and help them prevent coming back. We help to better understand those provider instructions and medications. We've all gone to a doctor's visit and gotten news about something, and we're not really sure what to do with that information after we leave the doctor's office. Maybe there's a question we forgot to ask. We didn't quite understand what they were saying, and we're there to help them kind of understand those instructions. We help communicate and provide feedback to the providers regarding changes in that patient's health status. And then we help manage chronic conditions to reduce that emergency department utilization and the rehospitalization. Once they go home from the hospital, we want to help keep them out. So the eligibility guidelines for our program, like I said, they must be 65 or older currently on the grant funding that we're on right now. They must have an unmanaged chronic condition. So this could include diabetes, hypertension, COPD, or congestive heart failure. Currently, the Ways to Wellness Connect program has 3 methods for referrals. So that's Apricot, which is a secured online database, by fax, or by phone. So all of our referral requests are replied to within 3 business days. The provider who sent the referral will hear back from us within those 3 days as to whether or not the patient is eligible, if we've reached out to them and been able to make contact with them, and if we've been able to schedule an intake with the client. When you send a referral request, whether it be to Apricot, by fax, or by phone, we ask for some paperwork to be included, and that is just, we like to have a note from the last office visit or a hospital note, depending on where they're being referred from, medication list, and then just their demographic info, a face sheet. So a little bit about Apricot. So what is this secure database? This database it was implemented for our program to house all of our electronic health records. We put in all of our incoming referrals in there. Every client interaction is in Apricot. Apricot is HIPAA compliant. And it's a web-based platform that can be accessed by our community health workers anywhere that they have access to the internet. So we can get into their records if we are at the client's home. We can work from our home if we need to, work on the road. We're out and about all the time. We need to be able to access these records wherever we are. And Apricot gives us the way to do this securely. So now you're going to hear from Allison Bro. She's the RN care coordinator for the chronic care management team at Weeks Medical Center. Working with this chronic care management team was really our pilot program, and they have been a huge asset in helping us getting our program up and running, and they were so gracious to allow us to work with their patients. So Allison's going to tell you a little bit about that experience and the successes from some of their patients.
Hi, my name is Allison. I'm the Registered Nurse Care Coordinator for Weeks Medical Center. I work both inpatient and outpatient setting. And this is my experience with the community health workers. The community health worker program was first brought to my attention when I entered my role of care coordinator for Weeks Medical Center. It has been tremendously helpful in coordinating care for patients with chronic diseases, as well as those recently discharged from the hospital. Patients usually are identified by really any of our healthcare professional that comes in contact with a patient. Before we had the community health worker, we often were struggling with issues, questions such as how can we engage the patient to take better care of themselves? How can we follow up with the patient once they left the hospital or the doctor's office, especially if there was issues of non-compliance? So sure, there's home health out there, but with home health comes certain requirements, such as the patient has to be homebound, there needs to be a skilled nursing need, and adequate staffing, which has been a recent issue. So patients were falling through the cracks. So we started a chronic care management program here at Weeks, where I meet with the patients, come up with a care plan, help meet some goals, and occasionally I can do a home visit. But unfortunately, budget-wise, we couldn't justify a nurse visiting every patient. So then that is where Annette and her wonderful community healthcare workers came in and saved the day. They've helped us reach our goals of improving patient care, improving medication compliance and follow-up appointments, and decreasing our 30-day rehospitalization risks, as well as ED utilization. If a patient is identified through an RN case manager or the provider or even a medical assistant during a Medicare wellness visit, then we send the referral to a community health worker, and they're super prompt at getting back to us. Community health workers have directly impacted Weeks Medical Center, especially in regards to our quality indicators. They have improved patient satisfaction, they have improved medication compliance, and helping patients keep their follow-up appointments with providers and specialists. They've helped decrease our 30-day readmission rate, as well as decreasing the emergency department utilization. And they've really been helpful recently in improving our transitions of care from the hospital to the home. We now have community health workers that will come into the hospital, meet with a patient before their discharge, and just to make sure that transition is smoother. The patient is more comfortable than being discharged from the hospital, knowing they will be followed up. And there's many, many benefits to using a community health worker to our practice and to the patient. The referral process is really easy. I fax a referral to the fax number that they gave us with a brief synopsis of why I think a community health worker would be beneficial, as well as their last office visit and any other pertinent information. They usually get back to me within 1 to 2 days, telling me when they plan on meeting the patient, which community health worker will be meeting it. And then after that, I get regular contact, either through the phone call or through notes. They're always sending notes that I can update the patient's chart with and give to the provider. And like I said, it's been really helpful with transitioning from hospital to the patient. We have several tricky situations where we're worried about compliance when the patient gets home, or they're uncomfortable going home, and the community health worker has really stepped in to fill that gap and help that transition be so much smoother. And our providers absolutely love this service. They don't always get it. They sometimes think that the community health worker is going to go in and do vital signs. So I've had to clarify that, but for the most part, they just love it. I'm getting messages weekly from providers asking if a patient can get one of those community workers to help with a various amount of things. So that's been really great, and we've seen a great improvement, especially in medication compliance and just the socioeconomic well-being of our patients, because a lot of them do have certain social determinants that are impacting their physical health and their diseases, and we don't see that in the hospital or the physician's office side. We don't know that maybe they can't leave their animals, or they don't have a ride, or there's other behavioral things going on. So the community health worker can go in there, meet them where they're at, and help get them to where they need to be by just meeting those needs physically, mentally, emotionally, behavioral, looking at all the areas of life and their social determinants and what they can do to help meet those, engage with the patient, and then bring them back to us. It's been really great. I wanted to share one success story, one of many. So this is a 79-year-old female patient. She was living alone. She came in for an appointment and was found out that her TSH level for her thyroid was 100.4. Now, the normal range is 0.4 to 4. So as you can see, this was very, very, very elevated. We weren't quite sure what to do. We knew that this patient had non-compliance issues, would miss a lot of her appointments, no show, was very difficult to get a hold of. So we decided to contact the community health worker, did a referral, and I got a phone call from Amber that she was going to meet with the patient. I reviewed her lab results, and what we were hoping was that this patient, we could figure out how to get her thyroid level back to normal. So Amber met with the patient and found out that the patient was not taking her medications. She would forget to. Sometimes she was unable to open the pill bottles. So Amber worked with the patient. They set up a med planner, that box that you can put medications in, as well as assisted her in picking up her medications from the pharmacy, making sure she did her refills. And by putting them in the planner, it ensured that the patient would take them. Amber and myself would regularly check in with the patient just to make sure she was taking her medications. And at her last visit, her TSH had returned to normal levels. It was 0.8. So we got her exactly where we needed her to be. And even the primary care provider was so impressed and just stunned by the results of this. Her note, she actually said, "This is the best I've seen the patient in years. So happy, bright, and very talkative. No more confusion or fatigue noted." Because what we had noticed before was that she was just exhausted, sleeping all the time, miserable. So when we got these levels, or I should say when Amber got these levels where they needed to be, it made a huge impact. And like I said, this is just one of many success stories that we've seen since utilizing the community health workers. And like I said, they have really impacted our quality indicators, and most of all, we've seen how much our patients love having a community health worker in their lives. It's a really easy process to refer, and the benefits are just fantastic. I can't say enough for how much we really utilize this service and are so thankful that they're part of our community and part of our care coordination. So consider a community health worker for your practice today. Our providers love it, and it's made our job much easier in caring for our patients. Thank you so much.
We'd like to thank Allison and her team at Weeks Medical Center again for working with us to help these patients reach their goals. So now that you've heard from a provider's point of view on the CHW program, we'd like to show you how we, the CHWs, would work with a client from start to finish. Keep in mind that all the clients are unique and their stories may vary, but this is just one example of how a client's journey may look. So imagine you are a community health worker and you receive a referral from the chronic care management team at a local hospital. So we're meeting Jane. Jane is a 77-year-old female with unmanaged diabetes and hypothyroidism. She does not take her medication as prescribed, and she's considered a high ED utilizer. So what do you do? Where do you start? So to start our journey with Jane, we're going to conduct an intake. We're going to give her a call, schedule a time to go out and meet with her, and it needs to be where she's comfortable. That may be in her home. It may be at a local coffee shop or library. Really, you're going to figure out where is she going to be the most comfortable. We're going to start to ask her our intake questions, and we're going to gather that information that we need to really help her the best. We're going to ask questions about what are her personal barriers. Why is Jane not taking her medication as prescribed? What causes her to use the emergency department so frequently? Through these questions and talking, we're going to begin to build a relationship that's hopefully built on trust and respect. So through all those questions, what did we learn? So we learned that Jane is retired, she lives alone, and she has no access to reliable transportation. Because of that, she frequently cancels her appointments, and when she does need to see the doctor and something's wrong, she calls the ambulance and goes to the ER. So Jane has several unopened bottles of medication in her home. When asked why are they all unopened, she says that the arthritis in her hands actually prevents her from being able to open the bottle. We also learned that Jane is struggling to afford food, rent, electricity, and her medication. She's in danger of having her electricity disconnected for non-payment. So with all this information, what do we do next? So here's some things that we can do. To begin, let's guide Jane in applying for SNAP benefits and Medicaid by connecting her with a ServiceLink representative or possibly the hospital's finance department, someone that can help her complete that application start to finish and help her collect all the necessary documents. So if Jane's approved for Medicaid, we can help her arrange transportation through that. And if not, we can help her find the local resources for transportation so that she can get to her medical appointments, she can get to the pharmacy to pick up her prescriptions, and be able to get to where she needs to be able to manage those health conditions. So not being able to open the pill bottle because of the arthritis. So we can help Jane request those easy open bottles from the pharmacy and then teach her how to fill her own pill box. We can also help her access pill bottle openers. It's like a little device that goes on top of the pill bottle. It's larger, easier to grip, makes it easier to open those tricky pill bottles. We can then help Jane in applying for assistance from the town office, and they can help her pay her electric bill, help her create a budget, and then we can also help her make the contact necessary to develop a payment plan with her electric company. So then we can help Jane apply for ongoing electric assistance through local organizations. After we've touched on all those goals and helped her do what she needs to do with those, we would identify any other needs that may come up, or if she's reached all of her goals and is doing well, we would inactivate her case. So this is just a short success story about, we'll call him Robert. And so Robert was a client who was on a very limited income and he needed to apply for Medicaid. And the hospital that he goes to was trying to help him with that, but they never seemed to be able to meet up with him. They would make an appointment and he wouldn't be there, or he couldn't have all the documents he needed. And he just never had the forms filled out that he needed to. So they referred him to our program, and the community health worker was able to identify, well, he's not coming because there's a transportation issue. And so the community health worker went to Robert's house and helped him with the paperwork. Robert actually needed the community health worker to do some of the writing for him. He had, shaky hands, and the boxes to write in are very small. And the community health worker was able to help Robert obtain the copies of all the documents that he needed for the Medicaid application. So the community health worker, first of all, eliminated the need for the transportation to the hospital's financial aid office by just going to the client's house to do this. And then the community health worker was able to further help arrange transportation for other appointments. So the client ended up getting his application submitted. He was approved for a Medicaid spend down plan. So then the hospital was able to then put him on their charity care program. So this has really helped him out quite a bit. This next success story, Kate, she was a woman who has, is overweight. She has hypothyroidism, very, very anxious, and seemed to be quite paranoid. And then the referral came in just saying that she needed a lot of help with her diet, and that she was just overwhelmed with a lot of paperwork things that she had going on. So the community health worker, the first thing that they started to work on was getting that paperwork out of the way. It was a huge barrier for this client, and the client just couldn't seem to focus on anything else until this paperwork was done. So the client was able to get her CFI application done and submitted. It was a very long process getting all the necessary documents with a few mistakes along the way, but everything eventually came around, and the client ended up being approved for CFI and Medicaid. The community health worker was able to make phone calls once the client got those letters. There was a lot of questions, and the client was just too anxious to make the phone calls by herself. So the community health worker sat there with the client, and they were able to make those phone calls together and get the answers that the client needed. So after they had built this relationship between the community health worker and the client who had not left her apartment for things other than medical appointments in quite a long time, actually agreed to begin going for walks outside around the apartment complex. So then the community health worker was able to help explain to the client about the importance of taking her thyroid medication, taking it as it was prescribed. The client had been kind of self-deciding as to how much she needed to take and when she should actually be taking it. And since the CHW has been working with the client has started to change her diet, is now taking her thyroid medication regularly, has been approved for CFI, and is doing very, very well. So now we'll briefly talk about the New Hampshire Community Health Worker Coalition. The purpose is to bring together community health workers, health professionals, stakeholders, and those community leaders to promote the role and value of community health workers. The coalition gives all of those members the opportunity to just come together, share ideas, collaborate, and work towards some of these big goals that we have as community health workers. We have an opportunity to be a part of a healthcare solution. So we all know there's a workforce shortage, and community health workers can really help fill those gaps and allow the providers to work at the top of their license and serve more patients. The coalition offers educational and networking opportunities. At every meeting, we try to offer some sort of educational training to our members on different topics, because we all come from different backgrounds and do different things. So we try to pick topics that are valuable to everybody. The coalition provides a platform to inform the communities of initiatives and programs that promote healthy living. CHWs have been around for many, many years across the nation, really, not just in New Hampshire, under many different names, but still there's a lack of understanding on the role and value of community health workers. So the coalition serves as that voice for those community health workers to come together and promote our value and explain our role. Coalition members include community health workers and leadership from many diverse programs. An example of different programs. We have representation from oral health, refugee populations, community health care, the breast and cervical cancer program, childhood education, in both the northern and southern New Hampshire area health education centers. So membership for the coalition is free. We have quarterly meetings, typically held in Concord to make it accessible to the entire state. And then if you're unable to actually attend the meeting in person, we always offer a Zoom option, the ability to video in. To keep our members up to date on everything, we use a platform called Basecamp. So that's way too big of something to go into right now as to what exactly Basecamp is if you aren't sure. But it's an online meeting room essentially, where we post newsletters and updates on different things that we've been working on as a team. If we come across any community health worker job postings, we'll post them there. So it's a great way for everybody to keep in touch and to see what's going on in the coalition. If you would like to join the coalition, you can access the registration through this SurveyMonkey link here, the surveymonkey.com/r/join-NHCHW coalition. Or you can contact a member of the steering committee at the email address nhchwcoalition@outlook.com. And they can answer any questions for you or send you the registration as a PDF if that's easier for you. For more information on the Ways to Wellness Connect program, you can visit www.ways2wellness.org, or you can visit the North Country Health Consortium's website at www.nchcnh.org. For more information, you can also contact our program manager, and her phone number is 603-259-3700, extension 221. It's important to point out, to receive your continuing education credits, there are some steps that you need to follow. I just wanted to quickly touch on this for both CNEs and CMEs, and there's also options for other health professionals. So to receive this certificate of completion, you must complete the following 4 steps. You should have already taken your webinar pretest. That should have been at the beginning of this. Then you're going to need to fill out a web-based program evaluation, a web-based credit documentation form. Please be sure to include all your contact information and your credentials. And then you'll need to complete the required post-test just to verify your participation and to see what you learned. Once those 4 steps have been completed and we've received your credit documentation, a certificate of completion will be generated and sent to you. If you're having any issues with any of the survey links, please give us a call, 259-3700, extension 221. So thank you so much for participating in this webinar, and we look forward to working with you and your organization.